What if I told you that there's an organization shaping global health policy, influencing every country in the world, and some believe it could be part of a new world order? In today's video, we're diving into the World Health Organization, WHO, what it really does, how it operates, and why it's been the subject of so much controversy in recent years.
A new world order is emerging, a new axis of world powers.
The WHO willingly took China's assurances to face value, and they took it just at face value.
The WHO at a glance. The World Health Organization, WHO, is an agency of the United Nations, established in 1948 with the goal of promoting global health, combating disease, and improving overall well-being. It's headquartered in Geneva, Switzerland, and operates in over 150 countries worldwide. With 194 member states, the WHO plays a critical role in setting international health standards, coordinating responses to disease outbreaks, and conducting research on public health issues. Its mission sounds simple: to keep the world safe and promote health. But as we'll explore, the WHO is more than just a health agency. Some believe its influence could be far-reaching, even crossing into economic and political domains, fueling theories about a potential new world order. The role of the WHO has four key objectives. 1. Fighting disease. From eradicating smallpox to the ongoing battle against malaria, tuberculosis, and HIV/AIDS. The WHO works tirelessly to combat infectious diseases. In fact, the WHO was instrumental in reducing polio cases by 99% since 1988. 2. Health systems strengthening. It helps countries build more effective healthcare systems by providing guidance, financial support, and technical expertise. 3. Setting international health standards. The WHO plays a leading role in establishing guidelines for everything from vaccinations to safe medical practices. These guidelines are adopted by many countries and can influence their national health policies. 4. Health research and data collection. The WHO is one of the world's largest sources of health data, collecting information that helps governments and organizations make informed decisions. The WHO's influence on global health policy. The WHO doesn't just suggest policy, it has the ability to mobilize resources, direct funds, and coordinate global health efforts. It's the backbone behind international agreements like the Framework Convention on Tobacco Control and initiatives like COVAX, which was created to ensure equitable access to COVID-19 vaccines worldwide. In 2020, during the height of the COVID-19 pandemic, the WHO was at the center of attention. Its role in coordinating the global response, disseminating information, and even issuing warnings about the virus put it in the spotlight. But with this came criticism, especially over its delayed declaration of a pandemic and its handling of China's early reports of the outbreak. These controversies led to widespread debates about the WHO's transparency and political independence. WHO funding and its impact. The WHO is funded by a combination of assessed contributions, mandatory payments from member states, and voluntary contributions from governments, private organizations, and foundations. In recent years, voluntary contributions have accounted for nearly 80% of its total budget. The Bill and Melinda Gates Foundation, for example, is one of its largest donors. This reliance on voluntary funding has raised concerns about potential influence from private entities and governments. Critics argue that such funding could affect the organization's priorities, leading to decisions that may not always reflect the best interests of global health. Controversies and criticism. The WHO has faced its share of controversies. During the H1N1 influenza pandemic in 2009, some accused the organization of exaggerating the threat, allegedly influenced by pharmaceutical companies eager to sell vaccines and antiviral medications. Then, there's the criticism of the WHO's handling of the Ebola outbreak in West Africa in 2014. Delays in responding led to calls for reform within the organization, especially in its emergency response capabilities. In the last few years, especially during the COVID-19 pandemic, conspiracy theories surrounding the WHO and its role in a so-called New World Order have surfaced. Some believe that global health crises are being used as a tool to centralize power, with organizations like the WHO allegedly playing a part in creating a unified world government. The New World Order conspiracy. The term New World Order refers to the idea of a global power structure where international organizations and powerful elites would govern all aspects of society. Those who promote this theory argue that institutions like the WHO, along with other UN agencies and global financial organizations, are working to establish a one-world government. The idea gained traction during the COVID-19 pandemic when lockdowns, mass vaccinations, and global coordination efforts were seen by some as signs of this emerging order. The WHO Pandemic Treaty, a proposed international agreement to strengthen pandemic prevention and response, is often cited in these conspiracy theories. Critics argue that it could give the WHO unprecedented authority over national health policies, further consolidating power at the global level. However, these theories lack substantial evidence. While the WHO does play a role in international governance, its mandate is still limited to health-related issues. Claims of a secret global agenda often fail to recognize the complexity of international cooperation, where decisions are made collectively by member states. The future of the WHO and global health. As we move forward, the WHO faces the challenge of evolving to meet the changing needs of global health. Emerging diseases, climate change, and an increasingly interconnected world require new approaches to health governance. The ongoing shift toward universal health coverage, UHC, is a key priority for the WHO. It aims to ensure that everyone has access to quality healthcare without facing financial hardship. By 2030, the WHO hopes that at least 1 billion more people will benefit from UHC worldwide. At the same time, the transition to sustainable healthcare systems is crucial. The WHO is working to address the impact of climate change on public health, as well as the rising burden of non-communicable diseases such as diabetes and heart disease. How the WHO impacts your life. You may not think about the WHO every day, but its impact on your life is undeniable. From the vaccines you receive to the policies that protect your health during a pandemic, the WHO is working behind the scenes to ensure global health security. Whether you're traveling abroad, seeking medical treatment, or reading health guidelines, the WHO's influence is likely present. Its role in setting health standards, managing disease outbreaks, and ensuring equitable access to healthcare will continue to shape the future of global health. But with that power comes responsibility and the need for transparency, which is something the organization will need to continually address to maintain public trust. Conclusion: the bigger picture. So, is the WHO part of a new world order, or simply a global health body striving to improve the world's well-being? While conspiracy theories abound, the reality is more nuanced. The WHO operates in a challenging space, balancing health, politics, and global interests. Its importance in navigating future health crises cannot be overstated. As we continue to face global health challenges, the WHO's role in shaping policy and responding to emergencies will remain critical.
A new world order is emerging. A new axis of world powers. No prizes for guessing which one, the United States of America.
Now that you have a deeper understanding of the WHO and its role in global health, what do you think? Let us know in the comments. And if you enjoyed this video, don't forget to like, share, and subscribe for more insightful content on the world's most influential organizations.